there may be some liability back on his company. The fact that they knew he was getting threats, was it known to them? And did the board not then provide security at an event that was known? Even though they say they didn't advertise it, it's very easy to find out this information, especially when you get on site and the hotels have signs up, what ballroom they're going to be in, or, what event they may be having, or if there's a cocktail hour. So the fact that it was known that it was going to be in New York on this date, I think was enough information, obviously, to provide even a layman ability to find him. True copycats is if no one had this in their mind beforehand, all of a sudden now they think they want to do the same thing to someone else. But I think, like what we've seen in school shootings and things, people that have been thinking about it now see the effects of it, and they want those effects. So someone who may have been thinking about it, that was angry, saw this happen, and then now starts taking more action. I think you're going to see a lot more threats out there. Threats are, again, to scare people in the industry that you're mad at. Now they can reference this. The threat can come in. You saw what happened to him in New York. I'm going to do that to you. And the companies now have to, one, it's going to scare the executives more. And the companies now have to look at spending money for security. So I think those threats are going to increase. I don't know if you're going to see a true copycat, but you're also seeing a lot of people out there saying how evil healthcare is and how they deny things. And they're seeing that part of the public is, I don't want to say supportive, but there's a bunch of memes out there making fun of, like, he didn't have pre-existing conditions for what happened in his healthcare. So they're making fun of this incident. And I think the healthcare companies have to take note of that and understand the public is not very supportive of them. I've seen both. I've seen some really good executive protection details, especially with events like this when they bring either a board together or a lot of executives come together where it's going to be known. That's one of the key figures. When you have an executive, is their picture out there? Or how do they advertise on social media or something like that? But when they're having something like this where he's a guest speaker or a known speaker, then that like locks in one location at a certain time. And that's really, even if he had, say, one person security, an event like this, you'd probably want to beef it up to 2 or 3, because again, it's an event that people can find out about, that he's going to be knowingly at a place at a time. I think absolutely this incident is going to cause some companies to look at their security. If they don't have it, I think they're going to look at starting it. Maybe the ones that have it, are they enough? I do a lot of security assessments for companies. One, if they have security, I see if that security is actually providing what they should be doing. Should it be tailored in a different manner? I've had CEOs tell me, well, I have 2 security guys, but they're in the office with me, which is really hard to get in. But at night when I'm alone, I don't have security. And that's a mixed match of threats and having security where you really don't have as big a threat. So the assessments, if they have security, do we need to improve it or increase it? And if they don't have security, why don't they have security? The security within the health sector is kind of like the same across other companies. It's some companies take it priority, and the board actually directs it that the CEO is going to have it. Some have full time, up to 3 or 4 people, And then, as you see, some have none. So I find that across most industries, it's a priority because something happened before, or they're looking at either cutting expenses, kind of security doesn't, generate profit, so it can go away quickly. Or when they look at the tabs for this, having 4 full-time people can get expensive. But then some companies really value securing, and especially in an industry like healthcare, where you're denying people coverage and there's a lot of animosity with that. Or if a company fires, say, 5,000 people, again, now you have 5,000 insiders with information into the executives that may be angry.